Well, as cooler conditions sweep across the country, Aussies are being reminded to get their flu jabs now as well. The annual dose more important than ever as the fractured COVID vaccine rollout heaps pressure on our health system.
Yeah, it's important. So for more on this, we're joined by infectious disease expert Professor Robert Boy on the Gold Coast. Professor, is it safe to get our COVID and flu vaccines simultaneously, providing you can get them?
I wish it was that easy. No, we want to maintain a 2-week gap between each. So if you have your flu vaccine in the next week or so, then wait 2 weeks and then you can have your COVID vaccine. However, because COVID is more deadly, if you are booked for a COVID vaccine in the next 2 to 3 weeks, have that first, and then wait for 2 weeks before having your flu jab.
Right.
My mum had it yesterday, and she was fine. My mum's always ahead of these things, and she felt a bit fluey as a result of it. We know that can happen, but she was also wondering: is there the same need for it, given the way that we've suppressed COVID?
Yes, the flu jab is probably more needful right now because last year there was so little influenza around that the level of immunity in the community has gone down. Now, the flu virus does mutate faster than COVID, and so we're dealing with new variants this year. So there are new viruses in the vaccine that are covered. It's not live, it's a dead virus. It's just a component of the virus, but the flu virus is very much worth preventing because every year in Australia about 3,000 people die, and this year will be worse than last year.
I read a story with a parent whose child had come close to death as a result of the flu, and she said that the doctors kept asking her, has your child been vaccinated for the flu? And that really scared me, and ever since then I've got the kids vaccinated every year. Is it recommended? Is that something that you should do?
Yes, you should. For Australian children under the age of 5 years, it's a free vaccination from your GP or their practice nurse. It's a vaccine worth having. The risk of serious flu is especially high in older people, retired people, people with chronic medical conditions, and children under 5, and they can have a free vaccine, and it's a good idea.
Okay, so GPs are already under the pump at the moment, aren't they, with administering AstraZeneca to over 50s. Is it going to be okay for them to administer the flu jabs as well? Added pressure for them?
Yeah, you're dead right there, Karl. There's a lot of work they've got to do. Last year they vaccinated 17 million Australians against flu, and they were helped a lot by pharmacists and nurses as well. So working as a team in a coordinated way, we can get a lot of people vaccinated against flu in a pretty short space of time. And especially while we're waiting for the AstraZeneca vaccine for over 50s, it's a good idea to get your flu jab. If you can have your AstraZeneca soon, then have that first.
Yeah, I remember last year there was a lot of talk about getting the flu vaccine to make sure that hospital wards were free to deal with COVID patients. Obviously, the way that we have things under control now is slightly different, but the plea is still there, isn't it? We do need to get people vaccinated against the flu.
Yeah, we've done incredibly well. Our hospital wards don't have very much serious infection. We actually had an amazing impact on all sorts of respiratory infections last year, including flu, by having very good social distancing and having the borders closed. That's going to change this year. We're going to have more and more travel overseas. There'll be more viruses coming in, and there's more pressure on the system to maintain sensible social distancing wherever you can.
One day into the Trans-Tasman travel bubble as well, and an airport worker tested positive in New Zealand. The worker was fully vaccinated. What does that say about what we need to prepare for in the coming days and weeks and months?
It tells us that the coronavirus, COVID-19, will not be going away. It's going to become part of everyday life around the world. The hope is that the virus will mutate in the next year or two into a milder form. That's the big hope. But the certainty is that it will stay in the world, not so much in Australia, where we've got very good conditions of quarantine and the like, but it will be back. It's impossible to keep out ad infinitum. You just can't stop it from getting back. But what we can do is we can minimise it. And so the minimisation through vaccination is important. It prevents serious disease especially, but mild cases and people who have asymptomatic infection can still occur. They're protected against, but not quite so well as severe disease is prevented.
Very well articulated, as always. Professor Robert Boy, appreciate your time.